Welcome back to Atlanta & Company. I'm Ryan Cameron. Now, Kim Facial Plastic Surgery offers a comprehensive array of cosmetic and reconstructive procedures to naturally enhance your appearance for Better You here on Better You Week. And joining us today with more on the services they provide is owner and founder, Dr. Kun Kim. Thank you very much for coming on the show today.
Thank you. Thank you for having me.
Plastic surgery is a very competitive field. I mean, you look at any magazine or any newspaper, there's a whole list of different plastic surgeons. What's different about your service?
Well, I feel the plastic surgery is probably no different than a fine restaurant. We are saturated with great restaurants, but there's always room for one more great place, you know.
Right.
And I am blessed with the fact that I truly enjoy and love what I do. And if it is totally up to me, without my children and my wife, I probably won't even go on a vacation. I'm totally honest, and I love what I do. And I am supported by a great staff that supports me 100%. And I think my greatest competitive edge that I have are thousands of satisfied patients that I've had over the past 10 years in practice.
Wow. Okay, let me ask you this. You consider yourself an expert in non-Caucasian face specialty. What do you mean by that?
Non-Caucasian face refers to any face that is not that of a Caucasian, meaning white person. So we're talking about blacks, Asians, and Latinos, and anybody else that are not of European descent. Now, obviously, the ethnic features that these other groups of people have are quite different than Caucasian face, and also healing and response to surgery is quite different than a Caucasian face. And it's not uncommon for a white person, it's not uncommon for a non-Caucasian person to go to someone who is not well versed in techniques of ethnic face and get eyelids or rhinoplasties or other parts of the face rather botched up because they're not paying attention to the ethnic features that people want to maintain, which is very important.
It's not like a cookie cutter thing. You have to really know, the person's ethnicity to kind of be able to do that.
I think you have to be able to appreciate the specific ethnic features that they want to preserve and to change.
Okay.
Yeah.
All right, so what are some of the services that you offer in your practice?
We are a full-service facial plastic surgery office, and we offer everything from minimally invasive, such as Botox and Restylane, very common, very popular, to full surgical cases such as rhinoplasties and facelifts and eyelid surgeries. And then we have laser services such as hair removals, to photofacial IPLs, to complete line of skincare products, and skin resurfacing and the total skin rejuvenation type of things.
All right, now we have some pictures, so we want to take a look and kind of let you explain what's going on in each picture.
Okay. All right, this is a teenager who came to me for her dislike of her nose.
Okay.
And if you bring your attention to her nose, the uneven nasal humps and the tip area, we just kind of refined. And I think she is very happy with the outcome.
All right.
And this woman received a eyelid cosmetic surgery, upper and lower blepharoplasty, as well as mini facelift. She underwent and both of these are done totally under local anesthesia, no general anesthesia necessary, done in about an hour and a half for all of that. And I do these right in my office, and I think she had a great result. She looks very natural and not too,
So when you say local, that means that you don't have to go totally to sleep, or what do you mean?
No. 99% of what I do is done under local anesthesia without the necessity for general anesthesia. And I feel that the general anesthesia, number one, it's costly, but more important than that, is risky. There's no way a cosmetic surgery can harm a patient per se, such as killing or totally disabling the patient. But general anesthesia can do both. Therefore, if I can do something like this without the necessity to putting them to completely asleep under general anesthesia, I will do so at every opportunity. And most of my patients are very happy with that arrangement.
Let me ask you, what do you see as the future trends in facial plastic surgery?
I believe minimal invasiveness combined with maximum result is what we're looking for nowadays, and also natural changes rather than too plastic changes. minimally invasive procedures such as Botox and Restylane are hugely popular last 5 years. I've been doing lots of autologous fat injections. It's where you take your own fat and inject into various parts of the face to naturally enhance the hollow, aged area on one's face, and very popular lately. And also there are some great advancements in laser technology that's going to be coming about. There are a combination of ablasive and non-ablative laser that will both remove spots as well as tighten the skin that are coming into view. Many new technologies, and we're very excited about that.
All right, we're about to run out of time, but I want to ask you this. You're certified by the American Board of Facial Plastic and Reconstructive Surgery.
Right.
How are you different from a general plastic surgeon?
Facial plastic surgeon typically comes from the discipline of otolaryngology and head and neck surgery. That's otherwise known as ENTs. We are trained 5 to 6 years post-medical school in head and neck, facial, ear, nose, and throat area. That's exclusive to that region. Following the residency, we spend 1 to 2 more years in training in getting ready for facial plastic surgery boards. And then after you get that additional training, you sit for the oral and written exam, and you become certified by the American Board of Facial Plastic Surgery. The general plastic surgeon come from general surgery discipline, and then they take 2 years of additional surgery in plastic surgery, where they may take on burns and trauma and face and everything else about the body. And unless they have specific interest in face, they are, in my opinion, they are not facial specialists.
Okay.
Yeah.
Thank you very much for the explanation. Thanks for coming on the show today.
Thank you.
All
Thank
right.
you very much.
Now, for more information on Kim Facial Plastic Surgery, call 770-458-4255 or visit kimfacialsurgery.com. This segment was paid for by Kim Facial Plastic Surgery. And later on, Atlanta & Company will give you different options to staying young beyond your years. You don't want to miss these ageless remedies. But first, it's been years since she won an Emmy for a role on Cheers, and she has since moved on and is now going on a honeymoon. Check out our interview with Shelley Long next on Atlanta & Company.